Welcome to the Pranic Healing Podcast. I'm your host, Dr. Jason Yuan. And on this episode, we're going to talk about energy healing from the perspective of doctors and sort of the medical side of applying energy healing to patients. So on today's podcast, I have a very special guest. Her name is Dr. Mansi Vera. Dr. Mansi is a naturopathic physician. She practices functional and holistic medicine, specializing in chronic disease, mental health, neuromuscular disease, and preventative medicine. Dr. Mansi is also a certified YogaBody Breath Coach, health coach, nutrition therapist, and professional classical Indian dancer. She also loves experimenting in the kitchen, motivational writing, and getting lost in nature's meditation. So please welcome Dr. Mansi.
Thank you so much, Dr. Jason, for inviting me to the podcast. It's truly an honor and privilege to be here, especially in your mission to spread awareness about energy medicine and energy healing. So thank you so much.
Well, thank you, Dr. Mansi, for coming on. Me and Dr. Mansi are actually colleagues. We actually went to the same school for naturopathic medicine, and it's kind of crazy how many things we have in common, which makes sense. You know, two people being in holistic medicine, we kind of have the similar thinking with things. But yeah, I'm really curious to share your background, Dr. Mansi, because I know Mansi is a Reiki master, so she doesn't practice pranic healing. But I want to kind of share energy healing from the perspective of, a doctor in your field, Dr. Mansi. Can you share a little bit about sort of how you got into energy medicine in general? Because I know you kind of have a more of a rich history and background with that.
How I got into it was kind of accidental. The Reiki guru who I learned from, and he practices Karuna Reiki as well, so Reiki and Karuna Reiki. And he was visiting his brother here in the US. We're all family friends, and so we happened to meet, and he was asking me questions about what I'm doing for a research project in school, in high school. And I was telling him, this book that I came across from my mom about auras and whatnot. And he was so intrigued. He studies auras and chakras, and he does energy healing of any sort. That was when we first had our introduction. And I learned from him. I learned Reiki and Karuna Reiki, and I practiced it. I was a high school girl. I had a lot of health issues even back then, but I didn't really use it for so much of the health related things. But yes, there were definitely things that I used it for manifestation, working on something subconsciously, really reprogramming the mind, not even realizing that that's what's happening at the energetic level. And so fast forward, going to college, going to med school, and I really wasn't practicing a whole lot anymore. But I still had the tools. And then after med school, I got very sick, especially right after graduating. I met with this near-death experience, and my life changed completely. Getting a diagnosis of a very rare disease, and not even knowing if I would be able to walk or dance again, which is what I was told. And so when my life changed, he came back into my life as well. He reached out to me. He said that you're not feeling well, you're not doing well, your root chakra is really not in alignment. And I'm like, what? That kind of rekindled that whole process for me. And this time around, I got really, really into it. I kind of studied from scratch again, everything that I learned, and got into a routine of now doing it, for a few hours every day for my health. And fast forward 4 years from that point, 2020 was the diagnosis. Fast forward 2024, I am walking. I am doing the things that I was told I wouldn't be able to do anymore. This is really what I consider true healing, the truest form of naturopathic, holistic healing, paired with nutrition and diet and supplements and herbs and all of that as well. But this stuff really, changed my life.
Yeah, thank you for sharing that, Dr. Mansi. As a friend and my colleague, I can speak, for the audience that it was a really challenging time for you. And I'm so happy to see you on, the other side, getting better. And dance was to you and moving the bodies. It's just amazing to recognize the journey that you've been on, right? And sort of the, what we call like synchronicities, especially with your teacher and him meeting him in high school, but then, of course, in the moment where you needed him the most, he was there. I totally resonate with what you're saying, right? This energy medicine, this energy healing, it's almost like another pillar of holistic medicine, right? Because we understand the importance of having good diet, exercise, and, good mental health, therapies for that. This energy, which is all around us, and it influences our bodies in so many ways that most people are unconscious of, especially for people with more physical chronic disease. The root or the basic chakra, as we say, is affected. And, we have the tools, whether it's Karuna Reiki, whether it's pranic healing, whether it's healing touch or any other modality. There's ways of using these tools as like doctors, physicians, right? We always want to treat the root cause of disease. And I totally resonate with you because sometimes the truest form of healing can only be tapped in when you first become aware of this energy and you recognize it, and then you become open to using it. So thank you for sharing that incredible journey, Dr. Mansi. For the audience, we're very curious because you mentioned how you work on yourself, hours a day using this practice, this tool from a doctor's perspective, right? Where do you see energy healing coming in? Let's say when a new patient comes to you and they have, chronic disease, they might have diabetes, they may be overweight, they have high, blood pressure. When is it in your doctor's mind, in your clinical mind, you think, okay, I think energy healing might be good for them? When does that come up for you, and how do you use it?
Yeah, that's a great question. And it's been an interesting transition because I know you have kind of utilized it from the very beginning in your practice. And of course, for me too, I want to mention that even throughout my journey, you've kind of been that pillar of support with energy medicine, giving me that space, but also that healing as well. And even when I wasn't necessarily so open to it. So I think this is a very interesting transition point because that's where many of my patients are as well, that they may not have heard about it, they might not be open to it, but they need it. Generally, when it's a very physical disease, at least a few months ago, this is how I started off. I wouldn't necessarily, talk about energy medicine, but maybe I would introduce things like meditation, breath work, trying to get them into that space where they can kind of be with themselves and understand the importance of that. Those with more like mental health oriented things, or when I sense that they're very in tune with their surroundings, they're very in tune with their selves, their bodies, I introduce these options of let's do a healing session together, or consider learning this or going out to get a Reiki session, because I feel like they will be so much more open to it and receive it. So that's kind of what I use right now. I think everyone and anyone can benefit from energy healing, but like you said, right, our practice, or at least the two of us, we really do have a profound belief in energy medicine. However, that comes with being patient for seeing changes, seeing results. And that's sometimes not always possible to communicate. We can communicate that with our patients and clients, but having them understand that is a challenge, I feel.
It's almost very hard for us to definitively say you're going to have like X result after one energy healing session, three energy healing sessions, because I think science is still catching up with the exact mechanism of how energy healing works. And it's very different from medications, right? Because when you take a medication, you know when it's going to lower your blood pressure. You know when it's going to, affect your blood sugar. You know how it's going to affect your pain because other people have gone through that trial, right? Those research and experiments to approve of these medications. But with energy healing, because we're working with something so intangible, invisible, and very, how I would say, it varies based on the patient, the client. And going back to what you said, right? If you see someone that might be receptive, that might be more open to it, and especially for people that have maybe more mental health conditions, I find that energy healing tends to work very well in tandem with their therapies or whatever anti-depression or anti-anxiety medications that um, they may be taking as well. It can be very challenging, and I think that's the biggest challenging issue with energy healing nowadays is that it's really hard to say what the result might be from person one to person two, because it might be completely different. Yeah.
Yeah, absolutely. And the thing is, we know the more we study, the deeper we go, it's also influenced by other things that are, again, not tangible, invisible, like karma, for example. So it is a whole complex system. It's like the Western science way of thinking isn't necessarily quite yet in parallel with what
Yeah.
science is talking about. Yeah.
Yeah, and I think we could talk about a whole episode on karma, because if people think energy healing is weird, I mean, the concept of karma is even, I mean, it's so big picture. So, but of course, in energy healing practices, we recognize the influence of karma and how that is, I can't even imagine if there was a scientific device to measure karma, right? That would be kind of crazy and groundbreaking. So let's kind of jump into the next part. We talked about sort of your journey into energy medicine as a doctor. We talked about how you use it, when to use it for different patients, right? Seemingly patients that are more open, receptive, and patients that might have more mental health conditions can benefit a little bit better. But where does energy healing come into you from your day-to-day practice as a physician? Because for me, as we know, being in healthcare can be very draining, right?
Yes.
Because we are in acupuncture and Chinese medicine, we are called the Ling Shu. We are the pivot from heaven and earth, right? We are the channels for healing. And sometimes, maybe a lot of times, doctors, healthcare practitioners, we get drained as well because so many people are coming for us for health healing. And we might feel compelled to overgive and also overtake, right? Kind of taking on their energy as well. So, where does energy medicine come in for you, Dr. Mansi, as a healthcare practitioner to make sure you're in tip top shape and you can serve your patients the best by sort of keeping your energy kind of high and clean?
Yeah, I mean, I think you said it perfectly it is a practice. So you do it consistently and then you build on it. And that's exactly what I did. For me, it was a case where Western medicine didn't have anything else to offer to me. And so I'm either taking heavy dose drugs, which I couldn't even take that, or I find another path, which I've honestly been blessed with you, with my guru, with other practitioners or other people who think kind of in the same realm and offer these same suggestions because I think I really needed it. And so that kind of forced my journey inward. And my journey inward, understanding where my sensitivities come from. I've always been a sensitive and empathetic person, empaths, and we feel the energy of others. We feel the surrounding energy way more. I recognize that even with the patients that I was working with, I take on their energy, quote unquote. I take on their pain. Everything is energy, and everything, starts from the thought, and thoughts and emotions are, again, energies as well. Building a practice, working that practice into my daily routine of, cleansing each chakra. That's what I start with. And that's the practice that I do first to make sure that at least in that space, that energetic space, I can show up as the best version of myself and be able to offer the best version of myself.
I really have to agree with that, Dr. Mansi, because I think in my case, with my history in chronic disease, I was also kind of at the end road because, I was talking to so many different doctors, like, oh, this is the best we have. This is all that we have. And there's really no other options. And for me, that was a compelling reason why I looked into holistic medicine because, it saw the body being connected rather being what we call reductionist, meaning if you just have a skin issue, you just go to the dermatologist. If you have a gut issue, you go to the gastroenterologist, versus that we know how important each of these systems, these organs are connected. And I find that with energy medicine, it's all connected. When you follow the energy, it never lies. It's very almost objective, and it can lead you down a path to your true, authentic, ultimate healing, which again sounds easy and great, but it's still a path. And as we know, everyone's path is a little bit different, considering how many different layers of this disease and this energy might be affecting us on so many different levels. And we see that too in chronic healing. As a healthcare practitioner too, it's so important for us to clean our energy on a daily basis. This is literally what I do. Otherwise, I think I would be like taking Tylenol. I would be on different medications just to keep me mentally and physically, active and able to move. Because like you, I'm also very sensitive. I'm tend to be an empath as well. And we know how much of a challenge that is if you have all that and you take on people's energy and you try to be the best doctor you can be, right? And that's where, as we know, burnout happens. And burnout is so common nowadays. And we see so many, not only doctors, but any healthcare practitioner. It's almost not feasible to do your work with all this invisible, barrage of negative thoughts, negative emotions, dirty, congested energy in your field. So thank you for that answer, Dr. Mansi. In terms of kind of like for us to move forward with this concept of energy medicine and energy healing, you and I are naturopathic doctors. So we kind of almost see that in our toolbox already. But what's your experience working with other healthcare practitioners with energy medicine? Do you like bring it up? Do you tell them, hey, this is something that I'm working with this patient with? This is a tool. This is how their root chakra is now. Let's say, 10 years down the road. So a two-part question. What's your experience working with energy medicine with different healthcare practitioners, and where do you see it in the future?
Well, to be honest, with different healthcare practitioners outside of our, naturopathic field or holistic field, I don't really bring it up a whole lot. I think the extent to which I have brought it up thus far is really related to my own health and in people or professionals being surprised almost as like, what happened, what changed. You were there, not too long ago and now you're here. So what happened? If I sense that they would be receiving what I'm about to say, then I would share. And otherwise, I would just be more general right now, just to say, various holistic and naturopathic tools. And I would mention energy medicine, but not necessarily go into a lot of details there. Just because it's unfortunately, I think we're still at this crossroads where whether it's healthcare professionals or any professional, to be honest, the burnout, the stress, people are recognizing the emotional, mental, physical impact on their lives, their health. We're seeing younger and younger people develop chronic disease, autoimmune disease, cancer, passing away from sudden heart attacks. That toll all comes from things that are unresolved, whether it's at the physical level, mental, emotional level, or all of it. They recognize the need or the awareness around that, okay, something's just not right anymore, but they're not necessarily still accepting. That's what I've found, at least in my conversations. However, that said, they are open-minded to try holistic treatments. To answer the second part of your question, I think in 10 years, a lot will change. A lot more healthcare professionals will be in that realm of maybe even offering holistic treatments as well. I think they're getting training, and we know this from school, right? Dr. Jason, many medical doctors, MDs, are training to be functional medical healthcare providers. They understand that the body is not, a sum of it's not parts. It's a whole. It's a sum of all the parts. They'll be getting training in different arenas as well to help their patients, because what we're offering right now is limited. It really
Yeah,
is. And the side effects of medications, everyone can't tolerate that anymore. So we have to look outside, and I think they are. But in terms of energy medicine specifically, I think it'll take a few more years
sure.
to get there.
Yeah, and I have to agree. We both see that energy medicine is a complementary therapy to, of course, conventional mainstream medical treatments. Of course, some people are steadfast believers that you just need this energy healing, right, to fix everything. I don't think we're there yet at all. It might be for some people, but from the perspective of us as healthcare practitioners, again, we are holistic. We use energy healing as another tool in our toolbox to help the patients. And just like you said, right, our patients having more of these chronic diseases, these challenges come up, and not having, the solutions that are really right for them, but also doctors, right? Doctors are seeing it too. And they're also looking out for other ways to help their patients. I think that's important to say that, not all doctors are just like, pill prescribers, right? Some doctors, as you've mentioned, are looking into more holistic or functional medicine. And part of that training includes energy healing, or, the proper term is biofield therapies.
Mhm.
So I think I have to agree with you. We are at a crossroads because there's so much science, there's so much technology development in pharmaceutical drugs, different therapies, highly advanced therapies for the body nowadays more than ever. I think it's just as important if for us and our patients to continue to push for energy healing and show that it works, because you and I know you don't really need anything. You just need to learn it and practice it. As we say in pranic healing, it's like following a recipe, right? If you have the ingredients, you follow the steps. That's really all you need, and the results show for itself. So thank you so much, Dr. Mansi, for sharing your information, and the way you're talking about it, I think brings the audience at ease, because I think you provide a lot of clarity from your situation as a practitioner yourself and a doctor, and as a person that has used it on a regular basis. I think you're sort of the best guest to speak about this for us. In terms of how we like to close out the podcast, Dr. Mansi, I kind of ask every guest speaker the same question. Let's say a random stranger walks up to you, in the middle of the street, and like, "Oh, I saw you on the Chronic Healing podcast, and I heard you talking about energy healing, energy medicine. I don't really believe in it. So, what is your answer to them?" Because that person, I think, is more common than any other type of potential patient you'll see. What do you say to people that say, "I don't believe in it. It's invisible. It's just placebo. It doesn't work"? What is your response to that? Because I think that's a very challenging question for all of us.
We've talked about that too. I guess the answer would depend a bit on what they believe in, and start there. If ask about their breath, for example, do you believe in breathing? And breathing can help change your state of mind, from feeling very anxious to calming down. That's usually where I start. And I think most people have that experience using the breath as a tool to calm the nervous system, calm the mind. If they say yes, then I would say, okay, so you do believe in energy medicine, and it's just a little different in different ways, and that's perfectly fine. And kind of go about my way from there, because it's about awareness. I'm going to get better with energy medicine, with pranic healing. Another healer offered that to me. My own guru said, start your practice of Reiki and Karuna Reiki again. Like, that's how I'm going to get better. And lo and behold, that that was my journey. That was my destined journey to really go in and dig deeper. I think the awareness is the difference between someone who would believe it, receive it, and not. It's really about that awareness and drawing that mindfulness to those people who may not believe it, and that's fine. But I think we can all come to a conclusion that there is something. You don't have to believe in the medicine of it, but there is energy. There is a transformative process that can take place at any point through the medium of energy, whether it's the breath, whether it's NLP, whether it's EFT. There's more tangible ways to understand and recognize and believe it. And then as we go deeper into the science and practice of it, we start believing it through our own experiences too. And that further solidifies that belief. So a long-winded answer, I think I would start with something that is more tangible.
And I have to agree with you wholeheartedly, because I think for me as a practitioner, but also as someone that is passionate about spreading the benefits, the teachings of energy healing, part of my belief is like everyone has to learn this. Everyone must know this. And as we know, even in medicine, right, that you're going to have patients that won't do well under treatment, right? You're going to have it's just statistically, not everyone is going to get 100% better. And for me, that comes up a lot because there are going to be people that are going to be steadfast on their belief. Like, I don't believe in it because I can't see it and there's nothing to prove it yet. But I think what you mentioned is really important. If we can kind of connect the dots and bring it back to something tangible, like the breath, like the mind, like your thoughts, and how all that is energy, right? It's like your phone, right? When you use your battery, you can use your battery in different ways. And I think that it's important to bring that back as a objective example, because some people tend to be more logical in their mind versus some people tend to be more creative and maybe a little bit more accepting for this. So, and I think you bring up really many great points, especially for not only people watching this podcast, but for the people that might not be ready yet to learn about energy healing. I think that it kind of opens them up and see how that connects. NLP, neuro linguistic programming, EFT. There's so many different tools, so many different techniques, and there's just not one for everyone. But at least with the concept of energy, it's all there, right? So, and people can connect the dots for themselves. So Thank you so much, Dr. Mansi. It's been a wonderful conversation. And, as a colleague and friend, I really appreciate your time and, you sharing your really personal stories in your journey of how you got into energy healing and you becoming the type of practitioner you are today. And I will leave and share Dr. Mansi's links down below. If you would like to get in touch with Dr. Mansi, I'm sure she'll be happy to answer any questions you may have, just because she is a really great practitioner and she does so many different things, as I mentioned in our bio. Any last words, Dr. Mansi?
I just want to say thank you to you. Thank you so much for being you, not just to my friend and colleague, but you're an inspiration to me. I always say that to you, but you really are. And I'm so grateful for you, the work that you do, the healing that you offer, the friendship that you offer to me. And thank you for having me on your podcast. It's truly been an honor, a fun conversation, and something that we're both passionate about to talk about.
You're welcome. You're welcome. And this is why I say Dr. Mansi is the kindest doctor you will ever meet, because of all that she said. Because I'm not sure if that's all true. But yes, Dr. Mansi is really great, and the honor and the pleasure is all mine. So thank you so much, everyone. Thank you for listening to this episode of the podcast. If you've enjoyed this episode, please consider supporting the podcast by being a subscriber. And we hope to see you in the next episode. All right. Take care.